So we're just going to start off with a nice little short video. It is. Some of you may have seen it on Twitter. I don't know.
A jak ty w ogóle masz na imię? Nie chciałbyś zostać na śniadanie?
I would just like to say I like this transfer.
A gdybym to ja zajął twoje miejsce? Nie parkuj na miejscach.
So anyways, I know what you guys are saying. Man, look at these three men in their black turtlenecks. They must be sexperts. Well, after this presentation, you will be too. Ladies and gentlemen, my genitals are telling me yes, but my surgeon is telling me no. Sex after CABG, SCI, and THA. So the great Dr. Masterson once said, sex is an ADL. Anyway, moving on to sex after an SCI. So most commonly SCI patients are going to be males. So normally their first question is going to be, can I maintain an erection? Well, we have three different types of erections. We have the psychogenic, which is located T11 or below. That is sights, sounds, or thoughts that are arousing. Then we have your reflexogenic erection, which can be can be from touch or stim to the penis. And finally, we have the spontaneous or nocturnal, which is equal to sleeping or if your bladder is full. So arousal. Most can still get aroused from sensual touching, such as the nipples, the neck, the groin, or the ears. Some men may require an assistive device, such as a constriction band, a vacuum erectile pump, medications, and or injection. As far as orgasms and fertility, they often have something called retroejaculation, which is a pretty normal process where it's just semen going back into the bladder instead of out of the penis. And finally, they often require treatment to impregnate significant others. Looking at women. So for arousal, most of the times the women will have to ask their partner to perform oral sex or use a water-based lubricant to increase the chance for vaginal penetration. And the use of vibrators is often shown to help achieve orgasm, which can help reduce spasticity. For fertility, usually there's a brief pause in the ability to become pregnant. You can still naturally become pregnant, carry the baby full term, and deliver the baby once your period returns, although there is high chance of complications with pregnancy. And as far as birth control, most doctors do not recommend an intrauterine device or a diaphragm because they do not have the sensation to be able to feel something misplaced. And also the pill is not recommended due to chances of blood clots. Now to the meat and potatoes. Autonomic dysreflexia. So as Dr. Ryan told us, autonomic dysreflexia is a rise in blood pressure resulting from stimuli below your level of injury. So if you're T6 or above, you have to be worried about this. So autonomic dysreflexia can occur from the following. Rough stimulation to the genital area, using a vibrator for stimulation, ejaculation, orgasm, and infection or inflammation. So if you're experiencing any of these symptoms, you need to stop immediately and remove all clothing if you still have some on. Call the medical provider or 911, or have a nitroglycerin ointment 2% available.
Right, thank you, Kyle, for that titillating talk there. So, I'd just like to say, my sex life and my golf life are pretty similar, I try to put it in on the first time every single time, even though I never actually do. And the maximum number of strokes I've ever had on any given hole is 9. So, did you guys know that 75% of people with hip arthritis actually stop having sex completely? As you can imagine, it's kind of painful to do that. So if they have a THA, what they're going to do is they're going to say, Dr. Recker, I'm feeling good. I'm ready to go. And I'm going to say, hold on there, comrade. You've got to wait at least 6 to 8 weeks for good tissue healing before we can go ahead and continue with sexual activity, to decrease the chance of dehiscence or wound reopening. Okay, fast forward 6 to 8 weeks. Dr. Recker, I'm feeling great. And I'm going to say, whoa, hold on there, cowboy. Before you whip out your Kama Sutra and start questioning your own flexibility, let's talk about something here. You've got hip precautions, okay? As we all know them by now, flexion past 90, adduction, internal rotation are all no-nos after THAs. So we need to communicate this with our patients so that way we can decrease the chance for hip dislocation. About 1 to 2% of people after THA will have a hip dislocation. So not to put you guys in an uncomfortable position, but let's talk about positions, okay? So here are some positions that are recommended or not recommended. But I'm going to tell you guys this. Keep in mind that we come in all different shapes and sizes. For example, 2 large patients that are obese might not be able to achieve this position. So you need to talk with these patients and say, hey, remember your precautions that you have learned, and let's try to stay away from that flexion past 90, adduction, internal rotation. Also, some males who are very well endowed down there, some of these positions might be uncomfortable for the excessive amount of vaginal penetration that they might be able to achieve. So it's really just it's being able to communicate to your patients what those contraindications are and being sure that they are able to avoid them at all costs.
There we go.
All right, last but certainly not least, sex after CABG, coronary artery bypass graft. Typically is going to be performed via a median sternotomy, so centrally down the sternum there. There's a picture. I don't feel that picture does it justice, so the turtleneck's coming off. Do not be alarmed, people. So I just want you to So the incision is going to require 6 to 8 weeks for healing. But even after those sternal progressions, the patient's cleared, just being sure, avoiding placing extra stress on that sternum following surgery, and just the patient should pay attention to any symptoms that they're having in their sternum. So the American Heart Association does a really nice job going play by play, kind of seeing what happens to the heart during each phase of sex. So for instance, foreplay, there's going to be a mild increase in systolic blood pressure and heart rate. As sexual arousal increases, there's going to be a more modest increase in those. And that orgasm, 10 to 15 seconds at its peak. I thought that was kind of generous there. Heart rate are rarely going to exceed 130 beats per minute, and 170 millimeters of mercury. As we learned, sex is about 3.7 to 5 metabolic equivalents, which is essentially mild to moderate physical activity. So if a patient they're good for their 6 to 8 weeks of bony healing in their sternum, their surgeon clears them, but they're still concerned they're going to have some sort of cardiac event. ADLs that are similar would be climbing 2 flights of stairs or walking half a mile. So if they're able to do those without increasing symptoms, that would be a good sign that they're good to go for sex. With full recovery, studies have shown most patients are able to resume normal sexual activity. And patients generally report satisfaction with being able to regain that functional ability. Doctors recommend there should be a gradual return to full sexual vigor. So for instance, like once they're getting back into having sex with their partner, the partner can do more of the work initially. Low stress positions are going to be supine sitting, less stress on the heart. Higher stress positions are going to be standing and kneeling. And then just considering medications such as beta blockers, they're not going to get that normal increase in heart rate with that activity, or hypertensive medication, because if they're taking like erectile dysfunction medication, that can lower their blood pressure. So if they're taking hypertensive medication as well, they could have like symptomatic, like hypotensive type symptoms. All right, and since no Tenacious Sputum production would be complete without a little song and dance, we got a song for you here. Without further ado, this is a little medley here that we created called Sex and Cabbage. All right, ready? 1, 2, 3, 4. Hanging around rehab by myself, and I had so much time for this incision to repair, and there she was. But my double bypass, yeah, there she was. 2 flights of stairs, not short of breath. 3.7 to 5 METs. I'll walk half a mile straight in your direction. Mama, this ADL's the dream. Yeah, mama, this ADL's the dream. Mama, this ADL's the dream. Mama, this ADL's the and he's climbing the stairway to heaven. And I would do anything for love. I'd run right back to hell and back. And I would do anything